So now let's jump into the first project, the Utah COVID-19 Digital Collection. As you all know, the real effects of the COVID-19 pandemic began hitting Utah in early to mid-March. You might remember in early March when a couple of Utah Jazz players were diagnosed with COVID-19 moments before tip-off, which then ended up with the NBA suspending the current basketball season. It seems like after that event, the news of COVID-19 having a real effect on Utah began increasing daily, which ended up with higher education institutions, K through 12 schools, and many places of employment closing up shop and moving as many of their activities as possible to a telework or online instruction format. And then soon after that, Governor Herbert released the state's Stay Safe, Stay Home directive. Then along with these major changes in the way people had to live their lives came many stressful and creative solutions to how society works. In early April, the Marriott Library began talking about how we might be able to collect information from Utah residents on how we have all had to adjust our daily routines to be able to accommodate measures being taken due to this global pandemic. And from these conversations, the Utah COVID-19 Digital Collection was created. So we began soliciting photos and written stories from people across the state to help document this time in history. Many people may feel like their lives during this time have been really not so interesting, with being asked to social distance ourselves from others that are outside of our home. We've been asked not to travel outside of our own little area, and we weren't really able to eat inside a restaurant or even shop at every place that we would like during this time. While that may make life seem kind of dull and boring, it can also be fascinating to document what people are actually doing, since it can be so different from what we're used to. In the future, people are also going to want to know what really happened during this time and why so many things, especially these types of social events, had to change. And then in addition to having to deal with a global pandemic and the change to online schooling and work, the Salt Lake Valley then had a pretty significant earthquake around the same time, followed by a month of aftershocks, which then added to the stress of an already difficult situation. So with that background in mind, I want to show how you can contribute to this project and be able to share your story or your photographs with the world. So to find the project, you can go to the Marriott Library's homepage at lib.utah.edu, where you will find links to the project in both the news and events section there on the left, and then also the featured events and services on the right. So if you click on one of those, it will take you to more information about the project, and then this webpage where you will find links to where you can submit your photos and stories. So in the middle of that page there, if we click on the Submit Your Photos link, it would then take you to this form where you are asked a few questions about your photos, such as your contact information, the types of events that are reflected in the photos, and then a text box where you can just type any additional information that you would like to share about the photos, such as perhaps the date the photos were taken, what activities are happening in the photos, who is represented in the photos, and where were they taken. So after choosing which files you'd like to upload and send to the project, there's a permission to publish agreement, which basically says that you will still own the copyright to any items that you submit to us, but you are giving the University of Utah just the necessary permission to publish these items online in our collection. And once you hit the submit form on this form, it would upload your files and let us know to add those to the collection. Similarly, if you click on the link from one of those previous pages to submit your story, you'd be taken to this form here where you are asked similar questions, and then you can upload your story as a Word document, a PDF file, a link to a Google Doc, or you can type your story directly into the form that you'd like to share. So after we have received either your photos or your stories, we process them and include them in the Marriott Digital Library. So from this link on the page here, collections.lib.utah.edu, you can get access to all of the digital collections that the university libraries have made available, as well as many collections from partner institutions from around the state. So to find the items in this COVID-19 collection, You could start to search for items by typing a keyword in that search box in the middle, such as COVID-19. Or if we scroll down on this page, you'll see we have a featured collection section where the Utah COVID-19 collection is one of the featured collections on the main page. So if we click on that link, it'll take us to this browse page where we can look through all of the items that have been submitted to the collection and that we've added. So as you can see from this page, we currently have 749 different items in the project, and it's continually growing on a weekly basis. On the left side of the page, you'll find some different ways to be able to limit the items that you're seeing, such as choosing if you want to only view the photos or the stories in the collection. And then there's also a couple of options to view items that have been tagged with certain keywords or subjects, so you can find only certain types of items. So with that, I'm going to turn it over to Rachel, who will talk about some of the content that we've received for this collection.
Okay, thanks, Jeremy. So I'm Rachel Wittmann, and I am the digital curation librarian at the Marriott Library. And my role with the Utah COVID-19 digital collection has been reviewing the submissions as they are received, and also creating the descriptive metadata for each item before it gets published online in the digital collection that Jeremy just referenced. So as such, I've become very familiar with the contents of the collection, and I'm thrilled to give you some insights into what the public has been contributing to this project. The overwhelming majority of items currently in the collection are photographs, representing about 90% of the collection. And this is probably due to the proliferation of camera-equipped smartphones in 2020 and the ease of personal photography. About 10% of the collection is written stories, which, considering it takes more time to gather one's thoughts and put them in writing and submit them, it makes sense that this represents a smaller slice of the pie, as illustrated in the pie chart on the right. We currently have 3 oral histories with medical professionals, and we hope that those will grow. And these are interviews with people working on the front lines of the COVID-19 pandemic, which Dr. Gretchen Case will be giving you a more detailed overview in a bit. Within the photograph segment of the collection, I've attempted to analyze the content for reoccurring themes, which you can see in the bar chart. With the bar chart, you can see that the most occurring topics are what you would expect: social distancing, a lot of signs indicating closures of businesses, lawn signs, signs within stores advising of social distance rules, a lot of empty grocery store shelves, telecommuting for both work and school, and the ubiquitous face masks that we are now all wearing, and some of us are also sewing those too. But there were some more surprising topics, such as mannequins, which popped up, which I'll get into in just a little bit. But instead of telling you about the content, I will be taking you through some of these images from these major categories for some show and tell, which I hope will be fun and informative. But just to reiterate, what I will be showing you is just a very small representation of the collection, and I strongly encourage everyone to visit the collection online and browse through it yourself for an in-depth look. Next. So to start, I think the content we started to receive really mirrored the changes in daily life that the public was experiencing. And one of those earliest experiences in mid-March was food and product shortages at our grocery stores. And considering empty shelves are not something that we're used to seeing, this was well documented, and it was pretty diverse in terms of the locations, the different geographic locations within Utah, and different stores. Next, please. Common shopping experiences or daily shopping experiences changed dramatically with face mask requirements and limited numbers of shoppers allowed in a store at a time. And this resulted in lines of shoppers waiting to enter a store. And then once inside, we needed to maintain the 6-foot distance from other shoppers. So this is well documented in the collection as well. Next. And starting on March 16th, I think a day everyone will remember, right? Schools across Utah shifted to online instruction, and this abrupt change was a huge learning curve for children and a lifestyle change for parents. So most employers went to working remotely when at all possible, so that families were often home together, working and learning alongside each other. And here on the left, we see someone contributed a picture of their home office, which is set up in their closet, which, to be honest, looks pretty luxurious compared to my home office and a lot of other people's. And then on the right is a photo of siblings attending online courses together for their grade school, which we have a lot of documentation of that as well. Next, please. And so with so much time being spent at home over the last few months, we see a lot of activities of how people remained occupied and fed while at home. So there was a lot of cooking and baking going along since we can't eat out anymore. Here we have some pictures of soft pretzels that were a family's favorite snack. We have a lot of other several other baked goods and the sourdough craze that's been going on. Playing games at home is another way for that families have remained occupied. Other games that popped up that were more specific to the COVID-19 pandemic is the teddy bear hunt game, where people put bears and lots of other types of entertaining signs and pictures in the window, mostly for children, so that when they walk by, they have something to look at, or when they drive by. Next, please. Some of the more emotionally difficult aspects of the COVID-19 pandemic were also contributed to the collection, and we are very thankful to those who shared such personal stories. One family in particular, a father was diagnosed with COVID-19 and he was quarantined to the basement. So we have a picture on the left of the father down at the bottom of the stairs and his son at the top of the stairs. I believe he's trying to show him his grades that he received on the computer. And then on the right, actually the same family, the grandmother had to go to the hospital to seek medical care for leukemia, and at the hospital on her floor was where the COVID-19 patients were also supposed to receive treatment. So this is a picture of a granddaughter and a grandmother embracing and breaking social distance guidelines, because it's a very difficult goodbye, a temporary goodbye for them. Next, please. We actually received pictures of someone going through the COVID-19 drive-through facility and getting tested, which was very brave of them to submit. And this will help us, future historians, at least document the organized medical response to the pandemic. And so we're thankful that we have some photographs of that. Next. And we've also been able to document some of the efforts and events that have been happening at the Marriott Library, as TJ Farrell will be elaborating on his amazing effort to produce 3D printed PPE face shields for healthcare workers at the Marriott Library. And we have other photographs of some of the social distancing measures that were in place to make sure that everyone remained at a safe distance while in the library while we were open. And then other events just from the University of Utah community. Commencement, unfortunately, in-person commencement was canceled, I should say. So, it was witnessed some of the students kind of creating their own graduation ceremonies. Here on the right, we have a student who is walking in her bathrobe instead of her official gown in a private kind of DIY ceremony amongst friends. Next, please. And despite these overwhelming and stressful times, people often cope with creativity and humor, and we definitely see evidence of that. So as I mentioned earlier, with the surprising number of submissions with mannequins in the collection, people often were simulating human interaction with a, faux human being mannequin. One submitter created a whole series of photographs of herself and her mannequin named Betty. So here's just one picture, and I believe there's like 15 different scenarios she has her and the mannequin set up in, and she's putting the face mask on her mannequin. So that was very creative and unexpected. There's also, people deal with things humorously as well. So here we have on the right a mother and a daughter hugging of what they, deemed safety precautions. One daughter is covered in a sheet. And as far as I know, the CDC does not, approve of this method. So don't try this at home. But to them, that was their way of getting around the social distancing measures in order to give each other an embrace. Next, please. And for the written stories that we've received, although they represent a smaller portion of the submissions, we've definitely been able to capture some unique reflections and anecdotes. From the public, we've received some very personal accounts, including someone who unfortunately lost their mother during the COVID-19 pandemic, not due to COVID, but because of the pandemic. It really hindered the way her family was able to care for and grieve for their mother. Another example is an elderly couple who were self-isolating, and their children decided to pay them a surprise visit, and all, kind of remained on the street outside their apartment and sang to them while the parents remained on the balcony. And it was a really lovely, heartwarming story. We've also had quite a few submissions from students, a few from high schoolers, but mostly University of Utah students. High school seniors seem to particularly be impacted and upset because they were really kind of yanked out of their last months of being high schoolers and weren't able to see their classmates again and graduate as they had planned. So I think it was really difficult for high school seniors. We had quite a few University of Utah students submit accounts and reflections of, the sudden changes that were brought into their lives. There's this one quote, though, which I find very poignant. Most students at the University of Utah will long remember their spring break, not because of what they did or because it was extended, rather because it was a turning point in the world. And as I'm sure you'll remember, school was supposed to resume Monday on March 16th, the day after spring break. So it was a really abrupt change going from, students having a break and traveling or enjoying themselves to, a lot of changes coming up. And now Jeremy will be able to tell you more about the University of Utah faculty who incorporated some of these story contributions into their assignments and other outreach efforts that have bolstered submissions to the project. Thanks.
Great, thanks, Rachel. So throughout the project, we've been very fortunate to be able to collaborate and have support from several people, both at the University of Utah and from people around the state. So here are just a few examples of people at the university that have helped or will help to contribute to the project through the classes they're teaching by having assignments for students to write essays relating their experiences during the pandemic to the assigned readings within the class. Or some classes are even going to conduct oral history interviews with people about how they were affected by the pandemic. So we have some of those items in the collection already, like Rachel mentioned, but we hope to have more of them soon and hopefully several more in the fall. Then we were also contacted by PBS Utah, which you might know as KUED previously. PBS Utah was wondering about how they might be able to interact with the items in our collection. So if you have watched their Utah Insight series, which began the middle of May last month, you may have seen some of the images from our collection that have been used in their broadcasts. We've also had a lot of support from outside of the university, including several libraries, archives, museums, and quite a few public schools who have wanted to find a way that they can contribute to this collection. We're also working on developing several other relationships and other collaborations that we'll be able to announce hopefully in the future for projects to create more oral histories or to help document what the experiences the underserved populations might be going through during this time. And then in addition to all of these institutions that have been willing to help us collect items and to publicize the project, we've had a great response from our local news outlets, including 39 different TV news, radio programs, newspapers, or other online news sources in Utah and around the country that have helped to get word out about this project to help encourage people to contribute. So with that, one of the collaborations that was developed for this project was with the School of Medicine and the Eccles Health Sciences Library for an oral history project. So I'll turn it over to Gretchen and Brandon at this point to talk about that piece of the project.
Thank you. I'll start, and Brandon Patterson, who's on the line, I hope you'll jump in where appropriate. So I'm Gretchen Case. I'm the Chief of Medical Ethics and Humanities and the program at the School of Medicine. Sorry, I forget my whole title. And I want to start by giving credit where credit is due. And first credit goes to Patrick Okersey, who you see on the left. He's one of our emergency room physicians. He is on the front lines of COVID. He had the insight to say something historic is happening and we need to capture these stories. We need to capture the actual people telling the stories. And he reached out to Brandon Patterson at the library, who then brought in Jeremy, who then brought in me. Because before I had my current career, I worked for a long time as an oral historian. And it all came together so beautifully in a way that I rarely see a project come together, where everyone brought what they had. Our wonderful librarians brought their technical skills. I brought what I know about oral history. And Patrick Okersey came to us and said, and here are the stories and here are the people you need to interview. I have started off by interviewing physicians because that's who I work with, and because those are the stories that felt important to access and hard to access. And you'll notice that there are only 3 oral histories right now, and that's because these are very busy doctors. So we started this project about a month ago, and I'm continually trying to schedule some interviews with doctors. And what I have to keep in mind is that they are working very hard and they also need to rest. And you'll see that Patrick on the left, he looks a little ragged. He's just come off a night shift, and he told me he decided to do his interview in that state because he wanted to show what it's like. These oral histories, so Patrick Okersey is an emergency room physician, and then Danny Babel and Emily Signor are hospitalists, which means they are taking care of people with COVID who have been admitted. All 3 of them, these interviews are about 30 minutes long. They are incredible. These are folks who are really thinking hard, not just only about what they are doing, but about what the people around them are doing, about the incredible creativity that it takes to deliver medical care in the midst of all these restrictions, the new ways that they have to work with their colleagues, with families, with hospital systems, what's happening nationally. And they are all taking into account also what they are seeing, which is the COVID pandemic is impacting some communities more than others. And that would be the communities we've all been hearing about: minority, underserved communities, people who are considered essential workers, and they have deep concerns about this. So the people who have agreed to do this oral history project with me are people who are really thinking hard about what this means as a moment in history and what it's going to mean going forward. With all the people that I'm interviewing, the plan is I'm interviewing them over time. So all 3 of these folks have agreed to be interviewed in another month or 2 and see where things are there, because this is unraveling or unwrapping or whatever you want to call it so quickly. Things are going to look very different in a month or 2 or in a year. So I see this as a long-term project. I very much want to speak to additional physicians. I have a long list. I also have a list of folks who are helping with creative things like what TJ is going to talk about. How do we solve problems with other talents and skills that are on campus or in the community? But I do want to say that this oral history project is not just about physicians or the medical campus or the hospital. Oral history, and I say this as an oral historian, and I'll have Gabby post some links in the chat for you all. Oral history is for everyone. And the idea behind oral history is that history is a series of stories, and each of you have a story to tell in this moment. So if you feel that you or someone you know has a particular story that is important to tell, and that maybe they can't or don't want to write it down and they want to be interviewed, you can do an oral history. And it's not that hard. The biggest thing is to listen and not talk. But you could capture someone else's oral history and put it in this collection. And that would be an important part of the record of how COVID looked in Utah at this moment. I'm happy to be a resource, but I also think that people should feel empowered to do these interviews on their own. And Jeremy has made the process so simple that it's just clicking buttons and then having some way of recording. I wanted to give a minute to make sure that Brandon or Jeremy want to say anything they want to say about this project, but I just, again, want to say, like, this is one of the reasons I love the University of Utah, is that someone has a good idea and reaches out and other people respond and we make things happen. And that's what's going to get our community through whatever it is we're going through right now. Brandon, did you want to add anything?
Yeah, I was just going to mention that this is very powerful. I think Jeremy mentioned that these are some of the most viewed in the collection. So these are really hitting a mark with others. And so, yeah, I think as you mentioned, Gretchen, this is really something we're hoping to continue to build. And I think it is important to note that anybody can really do this. If you have a family member, and even if you're keeping social distancing and you just want to do it over Zoom, Gretchen and I developed a protocol for that, and that's something that I'm hoping to write a blog post about and post on our website soon to get that information out there. So we're really excited to share these stories. They're really vital. And we're, like Gretchen said, we're continuing to see an evolution in terms of not only the disease, but also those being affected by it, the protests happening in the community. So certainly we want to hear those voices and have those a part of this collection as well.
Yeah, and I should have said that I conducted all 3 of these by Zoom because of physical distancing that's necessary, especially for our physicians. They can't risk any further unnecessary exposure. So we recorded all these over Zoom, and you can see we're all, if you watch them, you'll see we're all at home and maybe learn something secret about us in the background.
Great, thanks Gretchen and Brandon. Like they said, these 3 items have been the most popular items that are in our collection right now. On average, these 3 oral histories have had 150 people view them. For other items in the collection, we have had maybe around 10 people view each of the photos or stories. So these oral histories are having an impact in the collection already. So if you want to be able to find these oral histories to watch or listen to them, you can go to the collection page like I shared earlier, and on the left side, you'll see a link to the Utah COVID-19 Oral History Project. If you click on that, that will pull up the 3 oral histories that we currently have, and as more are added, they'll also show up with that link. So thank you so much for contributing to the project through these oral histories. So at this point, we just want to encourage all of you to consider submitting your own photos or stories to the collection, or contact us if you have ideas for oral histories. And remember, you can find information about the project at lib.utah.edu, the Marriott Library's homepage.